Hey everybody, this video contains graphic medical procedures, so just be aware. And don't forget, please visit drer.tv. Thanks. Hello there YouTube. In this video you're going to be watching the drainage of a ganglion cyst. What is a ganglion cyst? Well, a ganglion cyst is the most common lump or mass found in the wrist. It can be found in other areas of the body, but definitely the wrist and the dorsal side of the wrist is the most common. Usually affects people between ages 15 and 40 and women much more than men. In the ER, there's really no special test needed. X-rays are going to be done to rule out other problems, but it really is not going to see the cyst. An ultrasound would be effective at seeing a localized area of fluid, but it probably will add little to the treatment and disposition. MRIs are very detailed, will provide a lot of information, but essentially it's not necessary unless you're suspicious of something else, or if you did an ultrasound on the cyst, this ganglion had atypical features like calcium or blood within it, or signs of infection, then of course you would do an MRI to better define it. Most of the time you would treat the patient with conservative treatment, just anti-inflammatories, rest like a splint, decrease the usage of the hand, as usage and overuse will cause it to swell up, and rest will cause it to get better and get less inflamed. The other treatments would be aspiration. You can put a needle and just drain it, but that rarely works well because the fluid within is very like jelly and it's hard to pull out, and you would have to use a really thick bore needle to actually get anything out, and a lot of it can remain inside. And certainly does nothing for the actual cyst, which will remain there, therefore can reaccumulate and cause problems in the future. Drainage, when you open up the cyst, works better at getting everything out, but again, it does not take care of the cyst. But you wouldn't take care of the cyst in the emergency department. That's considered minor surgery, and it's not the role of the emergency physician to fix this. And ultimately, surgery, where you open up the skin, you get the whole cyst out, pull it out, stitch it back up, and then it's permanent treatment. You get it rid forever. So let's go watch this procedure on a ganglion cyst. Again, the most common mass found in the hand, especially the dorsum, and it's non-malignant, and as long as it's not hurting, there's nothing to do. There are people that says you treat it with a penny and hit him with a Bible. Yes, trauma will break the cyst and the fluid will come out. And for example, I had a very painful ganglion cyst for a while, and one time I picked up a book bag and it got stuck, and when I pulled it hard, my wrist bent so hard it actually caused the cyst to burst. I felt like a heat go through my wrist and a lot of pain, and then it never came back years and years ago. So enjoy this video. We'll see you next time. Bye bye.
Do you want it bent more?
So the thing is, by draining it, we're not doing anything to fix that. You know, it'll come back unless you actually get surgery. Right before medical school, my dad had me set up with a surgeon, and we did x-rays and everything else, and I chickened out. I didn't do it.
But you said yours never came back?
And then one time I said I picked up a book bag, it got stuck, it bent my wrist, and then it never came back. I mean, still sometimes it'll get a little sore maybe, but I pinch and a burn.
I've watched a couple different ways they do it, and one of them I don't know what size needle he used, but he was trying to
Just
with a
aspirate
syringe,
it.
pull it out, and it was super thick.
Exactly. It's too thick to really do that. So it's better just to dab it. I mean, theoretically it would come out, but I don't think you'll get enough of it out, and just go ahead and open it up. I think it was best.
The one I watched, they smacked it. They smacked it with a book, and he was like, oh, he was cussing.
But you have to hit it just right. So sometimes they said take a dime or a small coin and then try to hit the coin with
Oh,
it.
really?
Because if you just hit, and it just hits here and stuff. It doesn't really do anything except just hurt.
Yeah.
It's good.
Yeah. There you go. The little pop.
See how it got like,
Mm-hmm.
like
Little
stuck
jelly.
on? There we go.
Oh yeah.
Yummy.
It is jelly. Jelly looking.
When you watch all those people popping abscesses and all that nasty
No, that's
stuff.
just worse. Yeah.
You never watch mine? My stuff?
Mm-mm.
I-
What are you on?
Oh my
On
goodness,
YouTube
you've
or
never
what?
seen me?
Well, I've seen you
Exit
tape, but I don't think I've ever like gone. You put it on YouTube, or do you have
Yeah.
something on someone else?
It's EDX is bigger, right?
No, no,
Or
it's easier than that. Just Dr.
it's a new one.
DRER.tv.
Mm.
And it goes straight to a web page, not the YouTube, but then from there it's got a YouTube logo on it. You click on that and then see, you wouldn't get that with a needle.
Mm-mm. Definitely not.
That's the thick, yeah.
I'm gonna bend it.
Maybe like this, yeah.
Hallelujah.
It's still coming.
That's it.
Awesome.
Yeah.
Get that little.
Yeah, you're right. Look at that.
Is this the most common place? I've seen other people get it in like
Yes.
their feet. And
Oh my goodness, all that was left in there.
Yeah.
Yeesh, sticky.
Oh,
Yeah,
it's
this
smaller.
is by far the most common place to wrist ganglion.
It's always in this. I've never gotten one anywhere else. I mean, I guess, what did I read? It's something like kind of a
It's
little
lot
lesion in the.
smaller now.
Oh yeah, way better.
Good alcohols.
Thank you.
Alright.
Wrap this a couple times with keep some pressure on it. Thanks. Finally somebody to do it.